Hey guys, welcome back to my channel. This is Dr. Shubham. Hope all of you are fine and doing great. So today I'm gonna talk about a very interesting topic over here. So the topic is the pre-flight assessment in the respiratory illness patients. So the patients who are having some sort of respiratory illness, uh, how to do the pre-flight assessment. So if these kind of patients are willing to board the flight in the coming time, then whether they need the oxygen in flight or not, whether they are safe to board the flight or not. So these are the some things which we need to make sure and tell our patient that whether they can board the flight or not, or whether they need the oxygen in the flight or not. So these are the British Thoracic Society recommendations which I'm gonna talk about over here. So first of all, what is the thing is that we need to ask ourselves that whether this patient require in-flight oxygen or the HCT. About the HCT, I will talk about that in the separate video. So HCT is nothing but the hypoxic challenge test. Okay, so don't worry that I will talk about this test in the another video, right, in detail. So first question is whether this patient needs the in-flight oxygen or the hypoxic challenge test we need to do. So let's find out. So that is the first thing which we need to see. Second thing is that how to come to the conclusion. So we need to ask about the baseline saturation. So we'll take the probe and put in the finger of the patient. We'll check the saturation levels. So baseline saturation level, is it more than 95 or less than 95%? On room air we are talking about, right? So let's say if the patient is having more than 95% saturation or 95% saturation approximately on room air, then in that case we shall come to the next question, right? That is about the MRC. Okay, so MRC or MMRC, basically this is the Modified Medical Research Council scoring for the dyspnea purpose. Okay, we'll talk about that in the separate class as well. So MMRC grading, we'll talk about that. Don't worry about that. Okay, so MMRC dyspnea score we need to see, right? So in this score, basically we are grading the dyspnea or the breathlessness. So if the person is having, let's say the person is having MMRC score 2 or less, right? MMRC score 2 or less, then in that case, if the patient MMRC is 2 or less, okay, let's say it is yes 2 or less, then we shall actually HCT or in-flight oxygen is not required in that case. So we shall tell that patient that you are safe to board your flight, right? So in that case these patient will be safer to board the flight. In case let's say that MRC score is not 2 or less, rather it is 3 or 4, let's say, then in that case this in this person we shall be looking for the 6-minute walk test or the shuttle walk test. Again, these tests I will talk about that in the separate video, don't worry about that. I will be discussing all these topics in detail in the separate videos, right? So just stay tuned to the channel. So here 6-minute walk test or shuttle walk test we will do. In case we will find that saturation is lesser than 84%, let's say saturation is lesser than 84%, then we come to the next question. So again guys, I'm just I'm just repeating whatever I have said. So first question is that does the patient require in-flight oxygen or the hypoxia challenge testing, right? Second question is what about the baseline saturation? Is it more than 95 or less than 95? For now we are talking about more than 95. If the saturation is more than 95, then we need to see the Modified Research Council, Modified Medical Research Council MMRC dyspnea score. Is it 1 or 2, I mean 2 or less than that, or is it more than 2, that is 3 or 4? If it is 1 or 2, then patient is safe for the next flight, right? And if it is 3 or 4, I mean MMRC grade is more than 2, then we need to come to the 6-minute walk test or the shuttle walk test. If the saturation is there could be two scenarios: saturation lesser than 84% or saturation more than 84%. If the SpO2 is more than 84%, let's say if the saturation is more than 84%, then again the person is safe to board the flight. But in case if the person saturation is lesser than 84%, then we need to check for the next question, that is hypercapnia, more level of carbon dioxide, right? So if let's say the person is not having the history or the risk of hypercapnia, right, history or risk of hypercapnia, if the person is not having any risk of hypercapnia, let's say, then in that case we shall allow the patient for boarding the flight, but we should be telling them for the in-flight oxygen at around 2 liter per minute, right? In case there is a history of hypercapnia as well, if there is a history of hypercapnia as well, then in that case we should be considering the hypoxic challenge testing. Okay, so in that case we should be considering the hypoxic challenge testing, right? So till now what we have talked about, just don't worry, let me summarize it over here itself. Okay, so till now what we have talked about, I said that first question, whether this patient, right, needs, whether this patient needs in-flight oxygen or this patient needs hypoxia challenge testing, right? Second question, what is the baseline saturation, right? Now what is the baseline saturation we need to ask, right? Let's say baseline saturation is more than 90%, let's say, sorry, more than 95%, then our next question is, what about the modified medical research council score, MMRC score, or MRC score also you can say. So what is the MRC score? Let's say MRC score is 2 or less, the patient is safe for boarding the flight. Yes, if it is more than 3 or 4, right, if the MRC score is, let's say, 3 or 4, let's say, then in that case we need to ask one more question, that is fourth question, let's say, that is 6-minute walk test or shuttle walk test. In that case we need to see whether saturation levels are lesser than 84% or more than 84%, right? If the saturation levels are lesser than 84%, then we should ask next question, what about hypercapnia, right? Whether the patient is having any history of hypercapnia or not, or any kind of risk of hypercapnia or not, right? About this part, if the 6-minute walk test or shuttle walk test, if the saturation levels are more than 84%, in that case again the person is safe for boarding the flight. Okay, if it is lesser than 84%, then we need to ask for the hypercapnia. Let's say the patient is not having the risk of hypercapnia, in that case what you can do is, let's say the patient is not having the risk of hypercapnia, so no risk, right? In that case the patient should be allowed for the oxygen, so oxygen in the flight at 2 liter per minute. Okay, next scenario could be that person is having the risk of hypercapnia, in that case we should be considering the HCT, in that case we should be considering the HCT, isn't it? So in that case we should be considering the hypoxic challenge testing, right? I hope everything is clear till now. Okay, now let's say let's talk about the different scenario over here. Okay, let's talk about the different scenario over here. I will change the color as well. Let's take the blue color over here. So again same question comes, does the patient require in-flight oxygen or hypoxic challenge testing? But now this time we let's say the saturation, baseline saturation is less than 95%. So more than 95%, if it is no, let's say, right, then our next question would be over here. Okay, our next question would be over here, that is the patient is on LTOT, that is the long term oxygen therapy, right? Some patients are there, chronic type 2 respiratory failure patients, or let's say chronic type 1 respiratory failure patients, right, who are having some sort of respiratory illness. Okay, and let's say the ILD patients, if they are needing the let's say 1 liter of oxygen support every time they are on the oxygen support with their nasal cannula at home, so some those kind of patient, right? So if the patient needs the LTOT, I mean, are they on long term oxygen therapy or not? let's say they are not on the long term oxygen therapy, they are not on the long term oxygen therapy. In that case, again you will ask about the hypercapnia risk or hypercapnia history. Answer would be same. If the hypercapnia history is not there, then you you can actually allow the patient to board the flight with the oxygen, with the in-flight oxygen at around 2 liter per minute. Let's say the patient is having the risk of hypercapnia, then in that case we should consider the hypoxia challenge testing, right? If hypercapnia risk is there, then we should be considering the hypoxia challenge testing. If the hypercapnia risk is not there, then we should be allowing the patient to board the flight, but in-flight oxygen, but at the rate of 2 liter per minute. I mean in-flight oxygen at the rate of 2 liter per minute. How would you know that patient is having hypercapnia risk or not? Simply you will do the arterial blood gas, right? ABG. Okay, in that we shall see the PCO2 levels, right? So that is the thing. If that is more than 40, that is more than 45 basically, so that is that tells the risk of hypercapnia. If it is lesser than 45, then the patient is not having hypercapnia. Okay, fine. Let's say the patient is using oxygen at home. Let's say the patient is on long term oxygen therapy. Then what you will do? If the patient is on long term oxygen therapy, then we should ask ourselves the next question. What is the next question? That whether this patient is having type 2 respiratory failure or type 1 respiratory failure, right? So if let's say the patient is having type 2 respiratory failure, in that case, type 2 respiratory failure means there is a risk of hypercapnia. There is a risk of hypercapnia. In that case, what we were doing in the risk of hypercapnia, we were considering the HCT. So here also we'll consider the HCT. So if the patient is having risk of type 2 respiratory failure, we will be considering the hypoxic challenge testing. As simple as that. If there is a risk of type 1 respiratory failure, then we shall allow this patient to board the flight, but the patient needs the in-flight oxygen at 2 liter per minute greater than LTOT prescription. I mean, if the patient was taking oxygen at home that was around 1 liter per minute, then in this case we need to give the oxygen in the flight at around 3 liter per minute. I hope you understood this, right? So that is the thing. So let's summarize this side as well. So here we had talked about the left side where the saturation levels were more than 95%. So here the saturation levels were more than 95%. Okay, then this is the table, and if we summarize this table over here, then let's say how it goes, right? So first question was same, guys. The patient needs oxygen in the flight or not, or the patient needs hypoxia challenge testing. Next question comes, what about the baseline saturation? Baseline SpO2. Now let's say in our scenario baseline saturation is lesser than 95%. Then we should ask ourselves next question. Okay, and what was the next question? That was about long term oxygen therapy, right? So does the person takes long term oxygen therapy? Now there could be two scenarios. The person might be saying yes, the person might be saying no. Let's say the person is saying yes, then what you will do? Then we need to find out that whether this patient is having either type 1 respiratory failure, right, or this patient is having type 2 respiratory failure. Okay, so whether this patient is having type 2 respiratory failure. Okay, in case if the patient is having type 2 respiratory failure, then you will consider the hypoxic challenge testing in this patient. Let's say if the patient is having type 1 respiratory failure, then you will allow the patient to board that flight, but at oxygen at the level of 2 liter per minute over LTOT support, over long term oxygen therapy support, which we have talked about here. Consider in-flight oxygen 2 liter per minute greater than LTOT prescription. Okay, so that is the thing. So that was the scenario when LTOT was needed. I mean, the person said that they are on long term oxygen therapy. Let's say the person is not on long term oxygen therapy. Let's say the person said they are not on the long term oxygen therapy. Then again you need to ask about the risk of hypercapnia. again you need to ask about the risk of hypercapnia, CO2 is raised or not, right? Let's say they say that there is a rise in CO2 levels, then in that case they need the hypoxic challenge testing, right? In that case they need the hypoxic challenge testing. If they say yes, if you see that in the ABG there is hypercapnia, let's say that they are not having the hypercapnia, so in that case simply you can allow them for the flight at the rate of oxygen at the rate of 2 liter per minute, right? So if they say hypercapnia is not there in the ABG, if you find out that hypercapnia is not there in the ABG, right, hypercapnia is not there, then oxygen at around 2 liter per minute they can be allowed like that. Okay, so I hope there is no confusion you know in the recommendations, basically, that what kind of patient needs the hypoxic challenge testing, what kind of patient needs the oxygen support in the flight, right, and what kind of patients uh, do not need the oxygen in the flight. I hope everything is clear, and I will be coming up with the separate videos on hypoxic challenge testing, what are the MMRC grading scores for the dyspnea, what about the 6-minute walk test, what about the shuttle walk test. All these things we will be discussing separately, so don't worry about that. I hope you enjoyed this video, and I will be coming up with the new one. Thank you.